My name is Associate Professor Michael Back and I'm a radiation oncologist based at the Royal North Shore Hospital in Sydney. In September this year, I've been invited to give an oral presentation regarding our research from the Brain Cancer Group at the European Association of Neuro-Oncology, the largest neuro-oncology meeting in Europe. Part of the research that I'm presenting is based around the management of patients with high-risk meningiomas. These are often benign tumours that occur on the surface of the brain, but in certain cases they can act more aggressively with a higher rate of relapse. There's a lot of controversy at the moment around the world as to whether patients with these atypical meningiomas or grade 2 meningiomas should be managed with observation or be managed with initial adjuvant radiation therapy. The research that I've conducted and will be reported was looking at the outcomes of patients who have been subsequently referred for radiation therapy after relapse on an initial policy of observation after their surgery. What we found was that patients who have relapsed after that initial surgery and have been watched often relapse with multiple areas around the surgical cavity, and thus it's not a simple task to reoperate in those cases, and those patients are then referred to radiation therapy. We're also getting some information, though in a limited data set, to suggest that these patients may have a higher rate of relapse if they're observed initially rather than receiving radiation therapy up front. There is a large study being conducted around the world, which we've been part of, which has randomly allocated patients to either surgery alone or surgery followed by radiation therapy. We're still waiting on the results of that study. So in the interim time, this data from the Brain Cancer Group and the North Shore campus is very helpful to getting a better understanding of which patients should be offered radiation therapy after their initial surgery for this high-risk subgroup of patients with meningioma.